Everyone is welcome to my presentation. What we can say here? Yes, it is Ginbur's. Ginbur's is the name given to the Mount Everest most famous dead body of a climber known Swang Pelger. His body was kept unchanged near to summit for about 20 years. Most interestingly, the green boot is so famous at that time because it served as a trail marker for those seeking to reach Mount Everest from its north peak. Can you see a dead body underwater? Yes, a dead body of an unfortunate diver was found in Lake Michigan who disappeared 13 years ago. His body was nearly remained unchanged. How his body was preserved? By the formation of adipocere or grave wax, which is a modified form of putrefaction where hydrolysis and hydrogenation of body fat produce wax which covered the body and ultimately preserved it. We all know about it. Yes, it is Pyramid of Egypt that were built as tomb for mummies. Mummification, an ancient technique of body preservation, was practiced throughout most of the early Egyptian history. But the earliest mummies from prehistoric times probably were accidental. By chance, dry sand and air were preserved some bodies buried in shallow pits. Thereafter, they began to mummify the dead body intentionally. So from three stories, we can focus on three different techniques of body preservation. One is cold or refrigeration, that is mostly used technique, which is linked to my first story. Wax mounting is another technique used in a museum for preservation of viscera or specimen, which evolved from an idea of grave wax. Mummification is very much familiar word to us, which have historical background that I have talked in my third story. But the field of applying this knowledge was not so open earlier. At the time of First World War, the anatomists got the opportunities to apply different techniques of preservation for the availability of dead bodies. Now most commonly we are using mixture of different chemicals for preserving dead body, viscera or specimen, and plastination is the latest technique used in many countries. In Bangladesh, it is done only in BSMMU for research purpose. For preserving different parts of cadaver or whole is the important part of anatomy department in any medical college. So I have designed my presentation on preserving and treating specific parts of cadaver. I would like to quickly introduce myself. I am Dr. Jayasree Basu is welcoming you all. Let's start the main presentation. Why preservation is so important? Preservation is done to achieve disinfection, a pre-mortem appearance, long-term structural preservation with lifelike appearance, prevention of putrefaction and contamination with insects and maggots. For achieving all of these goals, we treat our cadaver by a process known embalming, which is science of treating cadaver. What are the chemicals and fluid we used for preservation? Preservatives, germicides, wetting agents, buffers, anticoagulants, dyes, vehicles and perfuming agents. For preserving specific parts of cadaver, our main emphasis is given to the preservatives, germicides and wetting agents. Let me elaborate further on preservatives. Formalin, methanol, phenol are commonly used preservatives. They inactivate bacteria and arrest decomposition. Let's see what is formalin. It is a commercial source of formaldehyde containing 37% formaldehyde gas in water and 7% methyl alcohol. The advantages are it is extensively active, cost effective, colorless and bactericidal. But the disadvantages are it has irritating pungent odor, unpleasant for skin, eye and face, weak fungicidal and insecticidal. What is methanol? It is 75% methyl alcohol that precipitate protein and kills microorganisms. The advantages of which are it is good solvent for other chemical, diffuse readily into the tissues and does not produce excessive hardening. But the disadvantages are it is highly inflammable, so during dissection it requires frequent moistening to prevent damage. Let's see what is phenol. This white crystalline solid that is volatile, colorless, mildly acidic. The advantages are it penetrates readily into the tissues and powerful fungicidal and germicidal. But the disadvantages are it is highly poisonous and produce marked tissue graying. What are the germicides we used? Phenol, butyraldehyde are commonly used germicide. They kill microorganisms and capable of reacting with protein structures and destroy cell walls. Phenol I have talked previously, and butyraldehyde is less commonly used. Wetting agents are glycerin, sorbitol, glycon. They reduce the surface tension of water and facilitate the penetration and distribution of embalming fluids through the vascular bed. Let's see what is glycerin. It is clear, colorless, syrupy liquid. The advantages are it retains moisture, prevent drying, keeping muscles soft, freely miscible, and good lubricant. But the disadvantages are it is very hygroscopic and causes dehydration of tissue if used in excess. What is sorbitol? It is available as 70% aqueous solution. It is more efficient than glycerin because it loses water at a slower rate. But the disadvantages are it tends to drop out of solution at a very low temperature. Let's see how we should initially handle the specimen. After collection, it should be immediately kept in fixative, normal saline or refrigerator. What should be the further processing of specimen? By dissecting, trimming, making it acidic, finally placing in appropriate jar with preservatives. Amount of preservatives should be ideally 20 times of the volume of specimen, but due to scarcity of the chemical we usually use less amount. What measures are taken during fixation? If the specimen is fresh and soft, it should be treated individually. Membrane, skin and intestine should be pinned on corkboard and floated. Unopened cystic cavities injected with formalin. Opened cystic cavities should be packed with cotton wool. Friable and distorted specimens should be covered with thin layer of acid gelatin. Blood containing specimen washed in normal saline, must not use distilled water. Bile stained specimen should be soaked in calcium chloride solution for 24 hours. What measures are taken in selected condition like decomposition and maggot formation? In decomposition, extremities and trunk walls are treated by hypodermic injection of undiluted fluid, wrapped in one or more sheets and placed in a thick polythene bag and sealed airtight. Before wrapping, strong embalming solution sprinkle over surface of body. The most important one is the stronger solution is to be used in treating decomposed parts. In maggot formation, the orifices should be flushed with kerosene, concentrated salt water, warm soapy water. Forceps are used to dislodge most tenacious insects. DDT and lavender water can be sprayed to kill insects. Insecticide is used in room temperature to prevent entry of flies. A piece of cotton can be packed in nostrils and other orifices of cadaver. Body should be kept covered. In conclusion, let me sum up the main points of my presentation. I have discussed about why preservation is so important, what are the chemicals we used, which chemicals are used for the preservation of specific parts, and brief description of those chemicals and amount of preservative used. I have already discussed about the initial handling, further processing of specific parts, measures taken during fixation of specific parts were highlighted, and at last, what measures taken in selected condition were told. Dear audience, we all know, but at the end of my presentation, I would like to remind you all that we should give proper respect to cadaver or any part of the cadaver from the core of our heart, because it is the source of our learning. Thank you all.